So our first speaker is Dr. Ritesh Narula. He works in LVPI as a senior consultant, and because he has access to all the machines available in the market, so he'll be giving overview which machine you have to choose and which machine will give the best results and what are the economics of these machines. So Dr. Ritesh Narula, please.
Very good afternoon to all of you. Thank you, Dr. Avninder, for inviting me to this interesting IC. OCT angiography, as he rightly said, is something which is the new baby on the block, which everybody is now looking at, wants to use, want to acquire. And so it's important to understand what is our available options and economics. I'll touch upon it. I'll give you the economics of it, and then you can decide how much economics suits you or doesn't suit you. I am going to be touching upon these machines not in a very theoretical manner. I'll try and just give you a brief overview of how these machines differ from each other, and then you can take your best call as to what suits your practice. OCT is a very important imaging innovation in ophthalmology in recent years. It has grown in leaps and bounds. A lot of uh, pre-treatment protocols are now based on OCT angiography. Slowly and steadily, it is trying to replace other forms of imaging. Uh, it's kind of becoming a replacement to dye injected angiography in quite a few scenarios. And as the time has gone, the OCT angiography has grown in resolution, the field of scan, the predictability, repeatability in terms of reducing the number of artifacts, all those have improved. So the world of OCT angiography is expanding from a small, very kind of magnified view to a larger kind of a view that you can get when you're looking at OCT angiography. And this has happened because of technological advancements, and there's a wide area of machines which are now available in market which you can choose from, select from. But to do that, you need to understand a few basic differences between these machines. I'll be predominantly touching upon four machines which I have personal experience of using, and try and show you the difference, and most of these are based on similar kind of platforms. So to understand the difference in machines, first you also need to understand what is the principle of OCT angiography. So to understand the normal or a pathological vasculature, what is done is serial OCT B scans are taken at each particular retinal point, and because of the blood which is moving within the blood vessels, the signal varies when the scans are repeated at the same point. This is basically reflections which are coming from erythrocytes within the blood. This reflection change is converted to what is called as a numerical value as a voxel, which is volume plus pixel as a combined term used as voxel, and which is then mapped out or plotted out for you to see. This all is happening within the machine. The machine uses either the reflectance or the change in phase to understand the difference which is happening between the reflected scan, and then it is projected on to you as a three-dimensional functional OCT image and with the vessel seen on it. So these are the four or five commonly available machines that are available, which I'm going to be talking about. So the first difference that one has to look at is what kind of a OCT machine that we are looking at. So the RTView XR Avante, the Spectralis and the Cirrus are spectral domain OCTs, while Plex Elite 9000 and Triton is a swept source OCT. So as we know, swept source OCT works on a more depth enhancement or more deeper penetration. You get to enhance your depth evaluation is a lot more. So that's one thing wherein they differ from the platform that is being used for OCT angio. The scan speed between these machines differs from 70,000 at RTView Avante to about 1 lakh for Plex Elite and Triton Topcon. The difference here is the faster the scans are, the lesser chances would be for artifacts to come in. Then is the wavelength. As I said, swept source, longer wavelength, they have more deeper penetration for you to see. Each of them have their own mechanism of tracking the eye movement and trying to reduce the motion artifacts, and each of them kind of works fine. A lot of them have now got incorporated to kind of reduce the projection artifacts and motion artifacts. Another important difference that you need to see is the axial resolution between these machines. So an Avante will have an axial resolution of about 5 microns to 3.9 by Spectralis and to about 1.95 by a Plex Elite or a 2 for the Triton machine. So grossly in terms of opticals, this is where they differ from. What they also differ from, which I'll talk about in the next slide, is the algorithm that they use to measure those voxels, or what we were talking about previously in the scan, and to kind of interpret those change in reflectance. Next, they also differ in terms of the area that you can scan with these different machines. So this, what you are seeing, are 4 different scans of 4 different kind of area that can be mapped out. The first one is a 6 by 6 mm scan. So the AngioView, RTView, Avante, which generally has a 3 by 3 or a 6 by 6 scan. The latest version also has an 8 by 8 scan for an Avante. From there, this what you see is an 8 by 8 scan. This is from Cirrus 5000. It's an 8 by 8 scan. Cirrus also gives you an advantage of montaging this 8 by 8 scan. So this is a montage of a Cirrus 8 by 8. And coming on to Plex Elite, which gives you a 12 by 12 scan, which you can further montage to give you a really almost beyond equator kind of a OCT angiography image. So this is how you can try and differentiate between the 4 machines. So you differentiate them in terms of their artifacts, their resolution, their area that they allow you to scan. So coming to the algorithms that we were talking about to evaluate these OCT angios, so there are 3 basic algorithms which are there. SSADA, which is the split spectrum amplitude decorrelation angiography, OMAG, or the optical microangiography, and OCTARA, which is OCT angiography ratio analysis. We don't need to go too much into detail of these mathematics. You have to remember SSADA is one which is with OptiView, RTView. The OMAG is the one with Cirrus, and the OCTARA is the one which is with Triton. So the difference is, when you compare these different algorithms, the OMAG as a method of utilizing this OCT science provides the best visual result for retinal microvessel networks. So OMAG, that means the Cirrus and the Plex Elite would give you the best retinal blood flow in terms of resolutions. SSADA, that is the one with OptiView, gives you the fastest of the scans with reduced number of repeat, because it has the least number of repeated B scans. So SSADA is able to give you a very fast kind of an OCT angiography. The OCTARA, which is developed by Topcon, it has a small issue that though it is a very high resolution scan, wherein the areas, it is best to develop the microvessels in a deeper tissue in terms of choroid. In presence of intact RP, all algorithms almost work well in looking at choroidal blood flow detection in terms of quantitative analysis. Wherein there are a lot of high reflectance materials like hard exudates and all present, OMAC can over diagnose vasculatures. So these are small subtle differences between the machines that you have to keep in mind. In terms of quantitative analysis, all of them are working almost the same. Also, you have to understand that these machines are not exactly replicable. For a scan from one is not exactly replicable to another. Why? If you just look at the segmentation from these different machines, you'll realize these lines are not exactly at the same level. So they have different algorithms within them, how they segment different layers of OCT. So an angioplex would segment it in a different way, and there will be subtle differences in what they call as RP and what they call as inner retina and what they call as outer retina. So these subtle differences are there between all the 4 machines. So one should very carefully interpret scans from one machine onto another machine. Now, specifically coming on to what does each of these machines offer you extra compared to what I have already talked about, the RTV Avante has something called as inbuilt angioanalytic software, wherein it gives you certain calculations which are inbuilt in terms of the vascular density, the foveal avascular zone, which can directly be seen on the machine printout directly here that you can see them. Also, you can calculate manually things like flow area and CNV area on Avanti. The Zeiss platform, that is Cirrus 5000 or Plex Elite 9000, it has an inbuilt montaging program which increases the field of view to quite a big extent. And it also in this montaging view, and though you can't segment each of those layers separately, but montaging is very beautiful when you're looking at vascular diseases of the eye, especially diabetic retinopathy and vein occlusions. So this is our images from the Cirrus 5000 6 by 6 mm high resolution. These are octas, where you can very beautifully pick up the networks of 6 by 6 on Cirrus 5000. And this is a BR view patient showing the 8 by 8, and then you can montage it to get an 8 by 8 montage, or a Plex Elite, which allows you to see this new vascularization going all the way beyond the equator also. Now, coming to Triton, Triton gives you an advantage that it also adds color fundus imaging, red free and autofluorescence, and in some models fluorescent angiography along with the SSOCTA device, and it's a swept source. So swept source means a deeper penetration. You tend to evaluate the choroidal vasculature a little better, choroidal thickness a little better with the SSOCTA system. So these are images from Triton, wherein again you can see. So in terms of network resolution, you are able to pick up your networks within the choroid very nicely in the outer retinal layer as seen here. It also has a bit of angioanalytic software attached to it like the RT-View. The Heidelberg has a very small area which it is giving. It doesn't have that big and montaging or an area that it gives you, but it is a beautiful multimodal kind of a platform wherein you can see, simultaneously do FFA, ICG, and Octa, overlay them over each other, and can compare what you are seeing on Octa with an FFA at a real time level, which can only be done with the Heidelberg system, not with any other system. Last, the cost, I have listed it up on, these are the approximate costs which are there for each of these machines. Now you have to understand what you require in your practice, how much can you afford, and then take a call what suits best for you, keeping these costs in mind. Thank you.
Which machine are you using at your center?
Sorry?
Which machine are you using in your center?
So,
And which, like you are using multiple platforms.
yes.
So which platform you see the best in diagnosing
So
this?
I'll tell you, in terms of when I'm looking at a diabetic or a vascular disease, my intent is to look at the montage, and I prefer using the Zeiss Plexelite or the Cirrus 6000, 5000, which gives me a large montage, allows me to go wider in my field of view. I prefer using that. But when I'm looking at depth of the disease, when I'm looking at choroidal neovascular networks, my preferred choice is using the TopCon system. TopCon gives me a beautiful swept source image from the deeper tissues. It's a real workhorse. It has a very, I mean, honestly putting, very low breakdown. It is very useful in terms of getting a fundus photo along with the TopCon OCT angio, and so that's my preferred choice when I'm looking at CNV networks. Though Cirrus also gives you a nice CNV network, but Cirrus, compared to Cirrus, the TopCon just gives you that extra when it is when you're talking in terms of depth.
And
Choroidal networks.
how are the fast tracking systems and motion artifacts
Now
that
most
you
of these
see?
machines have their own tracking system, all the native model. So the amount of motion artifacts, unless and until the patient is not at all fixating and is not able to just hold its eye, the minor, that saccade based motion artifacts, most of them have a kind of a way to tackle it. Also now they have, especially the Heidelberg and the Zeiss, have something called as projection removal kind of a platform also, where you can actually remove the projection artifacts. So that also works. So artifacts have gone down. I won't say they're completely gone down. Depends on patient's fixation also, and the more the retina is compacted, the more the number of artifacts tend to increase.
And which machine, if somebody has to buy in the audience to choose for a machine, so which machine and what should he look into the machine to buy that machine?
So look at what do you need this machine. Do you want a standalone machine where you are not interested to have an FFA, ICG, nothing of that sort? You don't want a fundus camera. So then you can look at a purely just an OCT angio machine like an RTView, which is little cheaper, gives you a decent and a fast scan, decent OCT angio and a fast scan. But if you're looking at something which can act for you both as a camera plus an OCT angio, or you're looking for something which acts for you as a angio plus.
And I want a definitive answer. You are giving
No,
pros
no, I'm
and
telling
cons.
you what you need in your practice. You have to decide if you want to buy two separate machines, a camera separate from an OCT angio, your choice. If you're looking at a standalone OCTA,
If you want to buy, what machine you will buy?
so if I have to buy, my first choice would be to go for a Cirrus 6000, honestly, because it's the best mix of giving me both the depth as well as the field. It may not have the 12.12 montage, but it has a good 8 by 8 montage, which is good
It has
enough for me.
got 12 into 12 scans also.
Yeah, it has a 10 into 12 single scans, but it doesn't have the montaging
Montage.
feature on that. But it has good 8 by 8 montage. It also has a decent depth. Also, it allows me to do a lot of image analysis also.
I just also like to, raise the flag of you mentioned. I think that's very right. That if you are thinking of diabetic retinopathy and things like that, perhaps the size systems are very good at giving you a periphery and looking at the vasculature in the retina. But if you want to go below the RP, my go-to is usually the spectralis because I just like SLO based systems. And it also allows me because in a lot of the cases of macular degeneration, we know in India it's about 30% is PCB. So to be able to do FFA ICG and juxtapose that against all this. So just
So
a thought.
Spectralis works beautifully with depth again as
Yeah.
either Spectralis or Topcon, which allows you to go more deeper. With us, it is we keep our Spectralis more for FAICG. We don't let it being used for OCT angio that much. So, but yeah. So as I said, it depends on what you're
And do you
using.
have Heidelberg system also at your place?
Yeah, we have. As I said, Heidelberg OCT angio we are not using that much because that machine mainly runs for doing our FAICGs. So
Puneet, will you like to add on to something about Heidelberg? How? But it has only eight, maximum of 8 to 8 scans. So what machine are you using, Dr. Rajesh?
So I have actually worked with the RTView, the Zeiss Spectralis 2, and also the Plex Elite. I think I agree with him saying that there's no clear answer as to which machine works best. It works best depending on your practice. If you already have a good Spectralis machine and a fundus camera, it wouldn't make sense to buy something that's got everything on because that adds to the cost. That's one factor. None of these machines are really cheap. And at this point in time, I think for retina, yes, I'm a glaucoma specialist, so there's much more value in retina to have this as a device, but it has still not become a definitive sort of required tool in anyone's practice at this point in time.